pregnancy stage. Now, what are the important diseases that can be prevented through vaccination? Well, there are lots of them. One of them is polio, for example. Polio is a disease that affects the limbs and the nervous system of the body. It causes people to be unable to walk. It affects mostly children, but as they grow older, they're unable to use to walk properly and they become disabled. So thankfully, polio can be prevented through vaccination, through both injectable and oral vaccines. And one of the great things about vaccination is that in 2020, Nigeria celebrated about 3 to 4 years of no infections at all with the wild polio virus. And that was because of vaccination. A lot of children in Nigeria were vaccinated when they were young, when they were just a few months after they were born. And what that meant was that several years after that, we experienced a period where there was no infection with that organism in particular. So those are the benefits of vaccines rather. Some of the other diseases that can be prevented through vaccination are very popular: cervical cancer. Cervical cancer happens to be a sexually transmitted infection that affects women primarily. The great thing about prevention of cervical cancer is that it happens to be that STI that can be prevented through vaccine, or that cancer that can be prevented. A lot of us have heard about cancer. A lot of us have probably heard about cervical cancer. Cervical cancer is the second most common cause of death of women in the world. And to prevent cervical cancer, really, women just have to get 3 doses or even 2 doses of the human papilloma virus vaccine. Another disease that can be prevented through vaccination is tuberculosis. So after birth, there's a vaccine called BCG, which is Bacillus calmette-guerin. And when we give that to children, in about 50% of cases, it protects children under 5 from developing tuberculosis. Without this vaccine, a lot of children in the world will be exposed to tuberculosis, especially in areas like Nigeria, in areas in sub-Saharan Africa in particular. And
so talking about that, Dr. Okoyemi, Doctor, I'm so sorry to cut you, but talking about the cervical cancer of the thing, what are the how will you say that healthcare practitioners in Nigeria are able to manage the situation, bearing in mind that most of these local women have heard some myth about the vaccine. I've heard something like, sorry, we can't use this vaccine because they said it's something that they just want to use it to cut us off so that we will not bear enough children and all that. So we've had so many women that are preventing other women from taking this vaccine. What are the things that is going to be done to ensure that it's being promoted and it's being done?
Well, one of the things that we can do, or that we actually do, for example, at our center, is counseling and health education. Counseling is very, very important in healthcare, especially in preventive healthcare. It's very, very important to address these myths and misconceptions, to address the mistrust that people have, to give them the right information about the vaccines, and to let them know whatever side effects could happen, to be as honest as possible in letting them understand that, yes, you can take the vaccine, but these are the things that you might experience. However, these are the things that it guards you against. Some of the things that we can also do is community engagement, which particularly work, for example, in the polio scenario. What community engagement does for us is that it enables us to meet with, say, traditional and religious leaders, for example. A lot of people in society, especially in Nigeria, respect their traditional leaders and they respect their religious leaders. So partnering with such people would help to inform women in that society and get them on our side and let them understand that, yes, it's important to get vaccinated.
Okay, yes.
Sorry, your network is breaking. I can't hear you anymore.
Apologies once again. I think Nigeria is happening to Janet's network. Apologies.
I'm very sure that the network seriously wants to deal with me this night, but I'm actually prepared for the network now. So I have opened it on another phone where I'll be jumping. So apologies in case if I have to join via another phone anytime this trips me off again. But Dr. Kwame, thank you for that insight. I'll be back to you. But right now I want to move to Mr. Chris. Mr. Chris, are you still with us? I hope you are not having the same issues that I am here.
No, absolutely. I'm here with you.
Oh, God. Now it makes me feel like I'm the only one dealing with this. So, Dr. Kwame was talking about how to handle the myth surrounding vaccination, which I would love if you can help us shed more light on. I mean, what are the myths that people have concerning this vaccination?
Yeah. So there are. Thank you very much, of course, for inviting me, Dr. Kwame. Background that you've laid down for the rest of us to speak on. So myth thinking or mindset about a particular topic, and it's something that is probably common to a community. And when it comes to that people have, of course, for different types of diseases that these vaccinations are given. So there are people who think it's one of the ways that the white people are using to reduce population. Okay, so so for some people, they would say that the vaccines would up, or when you're an adult and you're supposed to take a vaccine, so you would probably be sterile. That's one of the ways, or one of the things that the myth across communities or different communities when it comes to vaccination. Some people think that vaccination, in terms of the myth, is so because it's not working, then there is an ulterior motive for people who are providing this vaccination. Some people think that it's just a government way to make money, and so it's not relevant to individuals. And it's not, these myths are not things that we should do, that we should debunk, because a lot of time from particular experiences. So there was a time in this country when a pharmaceutical company decided to carry out a research, and it impacted in the number of children, number of deaths that happened, across the children that the research was carried out on. And it was just also about the to be produced. Some people have had to serve when it comes to vaccination. A lot of people do not trust the government. And so because they don't trust the government, they believe that the government are just using it to make money. So that lack of trust on the government is also part of the things that contribute to developing myths across vaccines, or even government projects that are being implemented or established in communities. I also think that these vaccines, usually because of the fact that some of these research were made, the subjects that were used to carry out the research to produce these vaccines you don't have adequate representation of probably Black people or Africans. So the thoughts around it would be this vaccine, or you were carrying out the research that will help you produce this vaccine. Subjects, during the research. So why are you now giving representation of Black people? So there are a lot of things that can actually cause things. And for some people, some of the experiences we had, especially during COVID, was if COVID is working, why are people still dying? Dying. Some other things that also caused some of the myth was the fact that they were saying that these vaccines produce quickly, and because of how fast these vaccines were produced, then it's either not effective or it's harmful to our bodies. And of course, for some people who also took the vaccines, they found out that, okay, some people concluded that, the vaccines get you sick. But of course, it's just part of the side effects of vaccinations. So myth encourage people from getting or taking the vaccine. But of course, these mindsets were developed as a result of certain experiences or certain things that have happened in the past. So it's important as public health practitioners, as doctors and medical health workers, and even we are intentional about debunking some of this myth. And most of the time, in fact, debunked using science-based information, because you can't just give information to debunk. Science-based information help to critically look at the situation and tell you exactly why the vaccine is important, and all of that. So as we continue to spread awareness, because that is actually where spread awareness and education in terms of how important vaccines, to look at these myths and misconceptions and effectively address them.
I'm sorry, please. Can you have one of the backend people?
You are muted, Janet.
Can I do this thing? Hello.
Yeah, you're audible now.
Thank you, Mrs. Sampson. I was coming to you actually because I would love you to join in this conversation and jump on this myth and the misconception. So, but I would love if you can talk about the strategies that can be implemented to increase the awareness and promote the importance of vaccinations and screenings within community, most especially in the rural environment, particularly all this undeserved informal populations. Like, what are the strategies that can be implemented to increase this awareness for them to be able to debunk the misconceptions that they have on vaccinations?
Great, and thanks for having me once again. And well done to the team. I really want to appreciate the the previous speakers. They've spoken very well about quite a number of. Yes, and your question is for me to speak to the strategies that we can use to increase awareness and promote the impact. Speaking to you from the perspective of the work we do in AF. I work with Association for Reproduction and Family Health, and we have quite a number. So I'll be speaking from a contextual point of view as to what we do, as part of our strategies. Dr. Chris said, he said there are lots of myths and misconceptions. And one of the ways we can actually tackle this, people have different beliefs about vaccines. And most of these beliefs are even the negative ones. They don't know the importance, they don't, as partners, as organizations, as the government. It's for people, even at the grassroots level, there's a need for them to really understand the essence, the importance of taking vaccines. So that's number one, is that we need campaigns down to the grassroots level. Also, as an organization, AF utilizes our various social media. So we use our various social media platforms to also increase awareness. Do it on a regular basis. So there's a need for us to use our various platforms. One of the very strategies, have a series for webinar, to create. So we have this webinar on a quarterly basis. And interesting enough is that we had an interesting webinar on the collaborative efforts for in Nigeria. So and we had diverse speakers from USCDC, from the Federal Ministry of Health. They spoke extensively on the various vaccines that are available in the country, on the efficacy of the vaccine, between HPV virus and cervical cancer. They went down to explain and cervical cancer amongst others. So we use our platforms for webinar series and engage with stakeholders at the community, at the state level, and at the federal level, including international partners too. In public health, during public to work for a community, it's the best thing for you is to work with the community, because it increases the chance for sustainability and community ownership. So right from the development of our projects, right from the development, we want to know what the problem is, we want to know how the problem can be solved. So there's a need for collaboration with gatekeepers. There are people we call gatekeepers. Just digress a bit. There's something we call stakeholders analysis, where you analyze the high power, the high influence, in the community. So we do all of this so that we can be very sure that whatever strategy, awareness, and to also to promote the importance of vaccination. So we do a lot of community with religious leaders, with traditional leaders. Interesting for you to know is that most of the church, because these vaccines are being brought to our our religious facilities. So there's a need for us to carry along our religious leaders, our traditional leaders, people. They can speak to the vulnerable group, they can speak to the community members, people that listen to them. They can help us increase awareness too. So these are several strategies that we use as an organization, to in the country. Another very important one is that we engage health promoters. Some states call them health educators. I'm working on the community-oriented DMPSC acceleration in Nigeria. It's a form of family planning. In the states, at the LJ level and at the world level, to carry out outreaches, to carry out vaccine campaigns. So what we do is we build their capacity for them to be able to have strategic outreaches, and not just strategic outreaches, but an integrated approach. That when they go to the community, they don't only speak to family planning, they speak to nutrition, they speak to immunization, they speak to malaria, so and don't forget that this is cost effective. The same person speaking to different things. And when they go to the community, what do? They go with healthcare providers. because we have healthcare providers at facilities and we have some at the communities too. So while they speak to the women of reproductive age, while they speak to the men, there are healthcare providers then, that, oh, we want this service. So we take the service to their doorstep. Take every of our intervention to the community to work with them as well. So another thing that we do as an organization is that I've spoken about health promoters and educators. So let me just speak about quite a number of our experience as AF, in vaccination and knowledge about the strategies we can use to increase awareness. We have a project is being supported by the USAID. And what we do on that project is that, okay, the project is being implemented in Edo State, in Kwara State, in Lagos State. So we work in conjunction with other partners, including the Lagos State government. What we do is that we're responsible for service delivery and referrals for immunization. You understand? And among ongoing, like the ACE4 project, which is being supported by the USAID, this project, is through research to understand the barriers, to create awareness. So what we do is that we undertake massive campaign, for the uptake of the HPV vaccine, and between the ages of 9 and 14. And this will help to increase knowledge about. Lastly, before I take so much of your time, the UNESCO project, which has just concluded, the Spotlight initiative projects actually focused on gender-based violence. But we also used that opportunity to also create awareness, focus on linking schools to health facilities for relevant services on violence against. Initiated the integration of HPV vaccination into the curriculum of. They can speak to one another. Oh, do you know what vaccine is? Do you know do you know the importance of vaccination and what we do? And then there's a need for the Nigerian government to still work with numerous stakeholders, to drive knowledge and awareness about vaccine. Of this event is doing, it's also a way to address the problem too. If everyone does, there will be significant progress and we'll be on our way to.
Thank you, Mr. Sampson.
Thank you very much.
Thank you so much. Before I move back to Dr. Opeyemi, I would love to tell you all that the floor is open for you. If you have any question that you would love to ask concerning what we are discussing, please kindly use the chat box. Because of our time, we'll not be able to take too much questions, but we'll be able to take like the first 3 questions. So back to you, Dr. Opeyemi. Do I still have Dr. Opeyemi here?
Hi, yes, I'm here.
Thank you so much. Thank you. So I want you to talk about how the role of the herd immunity in vaccination efforts and its impact on community health. What are the roles of herd immunity in vaccination efforts and their impact on community health?
Okay, so herd immunity is a very simple and I must say beautiful concept. Actually, it's like being your brother's keeper. That's how I define herd immunity. So what herd immunity means is that if many people in your environment, your direct environment or community are vaccinated against a certain disease, even if you're not vaccinated against that disease, to a pretty good extent, you are protected because their own vaccination kind of protects you. Since they can't get it, it's very likely that you will not get it from them. You will likely have to get it from outside that community. So that's what herd community is. And it's very good, actually, because it means that even for people that that don't feel comfortable with getting vaccinated, they are still protected to a large extent. However, it's still not as good as getting vaccines by oneself. The best thing, honestly, is to still get vaccinated. And that's also because while herd immunity confers a great level of immunity, it doesn't prevent totally the risks of having that disease.
So does this herd immunity, does it work for cervical cancer as well?
Well, no, not really. I would say no, not really. And the reason why I would say that is because cervical cancer is sexually transmitted. So even if a lot of people around that person are protected or have gotten vaccinated against HPV, if that person or if a woman still goes ahead to have sexual contact with a man that has HPV, she could still get infected. And it could take so many years for that to show. Also, which is the disadvantage of relying on herd immunity anyway, it doesn't prevent against the risk factors. It doesn't prevent against the particular risk. It also means that the person might develop a disease that will be more severe than someone who has actually been vaccinated against that disease.
Oh, okay, thank you so much. So then what are the key challenges ensuring widespread access to vaccinations? There are sometimes you have a lot of vaccine available, but you are trying to drag people to come take this vaccine. And sometimes you have a lot of people that want to take this vaccine, but it's not available. So what are the key challenges in ensuring that there are widespread access to the vaccinations?
Well, part of the key challenges are, first of all, lack of education. A lot of people have misconceptions about vaccines. In fact, some people don't think that vaccines work, which is not true because vaccines really do work. Some people think that if they get vaccinated, they would get the disease. So first of all, there's a need for education to be done. Another thing that could affect it is language barrier. Sometimes we have a situation whereby the community in particular that needs to benefit from that vaccination cannot speak the proper language that the person who is vaccinating wants to give, which is why it's important to have community volunteers sometimes. One of the reasons why polio vaccination got so much reach in the north, for example, was because there was so much engagement in the community. You had people, even in the south, you had people that would come to your house and knock and speak to you in Yoruba language, for example, and ask you if you want to get vaccinated, educate mothers in Yoruba about why their children should get vaccinated. So it's always very important to ensure that inclusion is focused on. It's not just enough to educate people, but it's very important to eliminate bias, whether gender or age or language or education barriers in everything that we're doing.
Can you agree that, will you agree that using the style of knocking from door to door can work for every other style of other types of vaccinations, like going from door to door, telling women about how important cervical cancer vaccination is?
Yes, I would agree personally. And there's a saying that if Muhammad doesn't go to the mountain will go to Muhammad. Sometimes people will not come to you. Sometimes you have to take the message to them, which is why I appreciate what Samson, for example, said about using webinars. We have to use all channels possible to reach people and to communicate to basically market the vaccines and health protection that we're talking about. And not just wait for people to come to our hospitals or to reach us or expect that people would only would be aware enough to seek health behaviors. A lot of times we have to go ahead and do the preaching to them.
Thank you so much. Back to you, Mr. Chris. So I'm back to Mr. Chris. Mr. Chris, what are the current trends and innovations in preventive healthcare, particularly in terms of the new vaccines and screening technologies? And how might all this advancement shape the future of healthcare practices? Hello? Oh, please, can we have Mr. Chris unmute? JP, please, can you unmute him? I think he's muted right now, please. And because of our time, I would love you, we can quickly address this in a few minutes.
Okay, so please, can you just...
So I said, what are the current trends and innovations in preventive healthcare, particularly in terms of new vaccines and screening technologies? And I want you to talk about how this advancement can shape the future of healthcare practices.
Okay, great. Thank you very much. If you look at COVID-19, you'd find out that the vaccine was based on mRNA, which is a vaccine technology groundbreaking, and it's still groundbreaking. Vaccine production, basically. So number of vaccines that were produced by different companies, because this mRNA is a technology that allows for vaccine to be produced. This is one technology that is groundbreaking, and it is also giving the opportunity for more vaccines to be developed for infectious diseases. There's also the expansion of vaccine coverage. We are carrying out the human papillomavirus outreach across the country. There's the first phase that has been done across 16 states, and now there's a second phase that is happening. And a lot of these organizations, for instance, IVAC, one of the things that they're doing is to engage ESOs, also engage community influencers, engage settlement or traditional leaders who would continue to spread the information about COVID-19 and about cervical cancer and the need for vaccination, and then ensuring that the information gets to the rural communities. Now, some of the avenues that some of these CSOs, okay, so things as simple as and shared amongst community members, especially by someone who is an influential person within that community, is a great way to use technology or innovative way to be able to ensure that vaccination or vaccines are taken by community members. Now, this particular way of ensuring that there is enough vaccine coverage, especially in low and middle income countries, and as also identifying to be able to educate people. And so you'd find out that things as simple as using social media platforms, designing or developing messaging in local languages that these people understand helps to get or take the information into. Now, one other thing that I've also researched to find with artificial intelligence in imaging, for instance, where you have AI powered imaging technologies to improve accuracy and efficiency in diagnostic imaging is important. Now, in cancer, for instance, some of the technologies or used in diagnosis are basically some level of imaging to be able to detect breast cancer, lung cancer, cardiovascular conditions, and all of that. So when you have AI powered innovative technologies, it helps to also increase accuracy and also efficiency. Now, some of and that, of course, I think will continue to improve is have some of these test kits that have been developed. Of course, it's in few years back, it's a new technology, and then of course they're improving on it to improve the sensitivity and the accuracy of the test. So, but then you have these test kits that you can actually use to test for diseases at the point where you gets to the hospital.
Okay, so Mr. Chris, because of our time, based on what you're saying, all this thing that you're talking about, can you discuss the implication of preventive healthcare interventions?
Yeah, so in terms of preventive healthcare interventions, when you look at these technologies and how they are working, of course, with the mRNA vaccines, vaccines are used, so as we begin to develop more of them, they're actually used to prevent diseases. Expansion of, the vaccine coverage across communities, education, awareness, and all of that are being done, and they are spreading across, rural communities, especially that don't really have access to information when it comes to screening or when it comes to vaccine diseases. For instance, if someone is aware of the preventive measures that they need to take to avoid a particular disease, they definitely will avoid those diseases.
So how investment in all these areas, how can they lead to long-term cost savings for healthcare systems?
Yeah, so we would say that we always say that prevention is better than cure, because the point is when you engage in preventive practices, it reduces the cost as compared to when you engage in treatment. Treatment is more expensive, and of course, when you look at the long-term effect of prevention across a community, healthier people who are also more productive in terms of having people who will come to work and not people who are absent at work. So you have a society that is productive. You have a society that, of course, with the productivity of the members of that community, it also influences the economic state of of that country or that community. And then, of course, when you look at in terms of how government invests in healthcare, at the beginning of getting all the equipment and all the things that you need for prevention, yes, it will cost money. But then when you put the structures in place, for instance, you have mammogram screening across the country where people get to be screened for breast cancer, you'd find out that over a long period of time, you have people and then they can be treated early as compared to having to be diagnosed of breast cancer at a late stage and you spend a lot of money. So it's more cost effective when there is preventive practices, and then it also who do not get sick, or have chronic diseases because they are detected country because of the investment of the government when it comes to preventive medicine or treatment per se. So on the long term, prevention would actually help in impacting positively on the economy of both individuals.
So on a lighter mood, there's this saying that anti-malaria drugs are much more expensive than malaria drugs. Well, that's the joke. Please don't go with that. Do not buy that. Just like what you said, that it is better to prevent it than have to go through all the stress, even if no matter how the stress of you having to fight a disease itself. Thank you so much. So, Mr. Sampson, quickly, we do not have much time. We have a few minutes left, and I really want you to talk about how care providers can navigate the balance between respecting individual autonomy and promoting public health when advocating for vaccinations and screenings. Please, quickly, briefly.
Come again, I didn't hear you.
So what I asked was that, can you quickly talk about how healthcare providers navigate the balance between respecting individual autonomy and promoting public health when advocating for vaccinations and screenings? There are some people that they just do not want to take the vaccinations, whereas there are some organizations that they want it, that you have to take it by fire by force. So how do healthcare providers navigate the balance between respecting individual autonomy and promoting public health when advocating for vaccinations?
All right. That there are healthcare interventions that have been there is so much of autonomy. You allow your patient or whoever it is to give a consent before you administer any drug or vaccine or whatever it is. So there's always that room for consent. You understand? So what healthcare providers will do is that they leverage on one of the uptake of vaccine is actually vaccine hesitancy. You get it? Now, vaccine hesitancy is being fueled by misinformation, misinformation and mistrust in the communities. So, and what healthcare providers will do is that we come up with strategic IEC materials. IEC materials are information, education, and communication materials. Some of them are being made in pictographs, and most of them are being put in culturally sensitive platforms too. We look at the culture of that place. We look at the language too. So most of these IEC materials are being put if they don't understand the benefits, they won't take it. But if they understand the benefits, there's nothing that will come to the mind of a healthcare provider to force whoever it is. And I'm sure that does not happen anywhere. So what we do as healthcare providers is that we also try to put some of this information on information, education, and communication materials too. So now another issue we have that I see that poses as a challenge is the capacity of healthcare providers. Most of our healthcare providers, they are, due to the jackpism and all of that, we do not have retention of healthcare providers. The jackpism I'm talking about here, for those who don't understand that very popular word, is a lot of people are leaving. Some of us who are on these calls, apart from myself, might not be here probably next month, because of the state of the economy. So what we do to care providers, we train them on how to do it and how best to do it. So we build a capacity too. Another thing that we do is that we do advocacies. We do advocacies to stakeholders, to relevant stakeholders, to the governments, to partner stakeholders too. We make advocacy for proper funding. In the community, the primary healthcare facility happens to be the first point of care. So there's a need for the capacity of our healthcare providers to be built. When you build the capacity of the healthcare providers, they know how best, to administer the vaccines to people and the underserved. Very, very, very important challenge that poses a threat too in the administration of vaccination too. We have a lot of infrastructure deficits in the country, and roads, we don't have good power supply, and most of these vaccines needs to be stored. That is where we store these vaccines before it is being administered. So to store these vaccines, thereby these vaccines losing their for an overhaul of the infrastructural amenities in the country too. And this will also help, to administer the right vaccine at the right temperature to people too.
Thank you so much. So because of our time, in 30 seconds, can you tell us what the government can do to encourage more widespread of this information to rural environments?
Come again?
In 30 seconds, briefly, can you tell us how the government can encourage more of this widespread information about preventive health care and the importance of taking vaccination in informal environments like the rural environments? Did you get my question, sir?
Yes, you said one of the ways, I should state the ways that the government, yes. Can what?
The ways the government can come into this and promote the information on this preventive healthcare in rural environment.
The rural environment, most of them don't use our iPhones, our sophisticated.
Because unlike why this question is because unlike people in the urban areas that are very much easy, have more access to information, and they can quickly go ahead and cross-check about these things. People in the rural environment, they tend to just move into one direction. So now, for instance, now there was a particular widespread about cervical cancer that was being spread that once you use cervical cancer, then you won't be able to, that the Oyinbos, in quote and unquote, are trying to reduce the population of Africans through the vaccinations. That was the same thing that we talked about COVID-19 as well. So what are the ways that the government, what ways are government using to spread more information in local languages to this rural environment?
I understood your question perfectly. Like I said earlier on, those are the rural, probably internet facilities and sophisticated phones. So there's a need for our government dissemination. There's a need for more radio jingles. Those are the rural communities, they listen their houses while on their farms. So there's more to do by the government as regarding information dissemination. There's also a lot to do when it comes to funding, be it rural or urban. There is a lot to do when it comes to funding. With facilities, that's the first point of contact for an average individual in the rural community. So there's a need for the government to fund our primary healthcare facilities so they can provide quality healthcare provided, at the best quality. So there's need for funding, there's need for information dissemination too, and there's a need. We need to go to the grassroots level, have meetings with our community leaders, let them know the importance of vaccination. So I'm only going to talk about funding, information gathering, and community engagement. It's actually very important. And these are the basic ways that the government, can come in, to increase awareness and also to advance the uptake of vaccines in our rural communities. Thank you very much.
Thank you so much. So I'll be rounding up with Dr. Okoyemi. Dr. Okoyemi, are you still in the building?
Yeah, I'm here.
So please, how can healthcare workers, how can they work hand to hand with non-governmental organizations, NGOs, and other non-profit bodies? How can they work together to ensure that there's a widespread of this information in rural communities?
All right, well, one of the ways healthcare workers can help and work with NGOs is, first of all, participating in things and volunteering. Volunteer work is always so important. Not everything will be paid for, honestly. It's important for all of us to put our hands together, whether paid or unpaid, to ensure that the people around us are also protected in the work that we are doing. Sometimes we have partnerships on vaccination drives. Sometimes we can do free discounts. We do that a lot at our own center, for example, where we sometimes dedicate an entire month to just subsidize vaccinations and all, just so that people can come in and get the appropriate care that they need. So those are ways that healthcare providers can also get involved with NGOs to ensure that they help spread the message. And one of the things I will also say is to be an ambassador or a champion of vaccinations and preventive healthcare. We all have our own different communities, whether it's in church or whether it's at home, whether it's in our families or with our friends. We can definitely inspire other people by talking to them and encouraging them to get vaccinated against diseases.
Thank you so much, Dr. Okoye. Everybody, as we conclude our discussion on the importance of preventive healthcare, I want to extend my heartfelt appreciation to all our esteemed panelists. Thank you, Dr. Okoye. Thank you, Mr. Chris, and thank you, Mr. Sampson, on behalf of the NSDSN. And everyone here, we want to say a very big thank you for sharing your expertise and your dedication. Have shed light on the critical role of vaccinations and screening in advancing global healthcare. Thank you so much. Your insights will undoubtedly inspire actions and collaboration as we strive to ensure equitable access to preventive measures worldwide. Thank you so much once again. Do enjoy your, will I say the weekend has started already? Because from here, it's started. Do have fun and enjoy the rest of the night. Thank you so much for joining.
Yeah, thank you.
Thanks, everyone.
Thank you so much.